Was submersion in the water for more than 6 minutes a contributing factor to the death of Hunter Fellers?
Yes, and that's what I listed on the death certificate.
And explain to us why that is.
I think that the reason that it is that seizures are somewhat common and they occur in some frequency. A lot of people have a seizure disorder where they have seizures pretty frequently. Another group of people have them just rarely. Most of the time that people have seizures, the seizure lasts for just a few minutes, and then they stop having a seizure, and they wake up and they start breathing, and they do fine. Okay. Occasionally, seizures do kill people. Occasionally, we do have people die, and we have no other explanation for their death except that they had a seizure. So that seizures do sometimes just kill people just from a seizure. But I thought that, more likely than not, his case, he has a seizure disorder, but he doesn't have very many seizures. They're very uncommon. And that had he not been under the water, he may have, more than likely, very likely would have, at the end of the seizure, started breathing again and woke up and got fine. But the fact that he's under the water, he didn't, and he either inhaled water or for whatever reason, he didn't begin to breathe again. He didn't begin to wake up and come back after the seizure. So the submersion in the water was a factor.
Doctor, when you did the autopsy of Mr. Fellers, were his lungs heavy?
Yes, they were.
What is the normal weight of lungs?
Probably around 300 grams on average. There's, maybe bigger people have bigger lungs, but as kind of an average lung weight, about 300.
When you say 300, you mean 300 per lobe?
Yeah, per lung. There's multiple lobes in each lung, but 300 on the right side, 300 on the left.
And sorry, go ahead.
The right one tends to be slightly bigger, so it might be a little bit more.
And what were the weight of Hunter's lungs?
His lungs were 900 grams and 780 grams.
And are heavy lungs a finding that is consistent with submersion in water causing or contributing to a person's death?
Yes, they are. That's one of the ways your lungs can get heavy.
Doctor, are you familiar with Dr. DeMaio's forensic pathology? That's one of the authorities in your field.
I'm familiar with the book, and I met Dr. DeMaio.
And Dr. DeMaio's book is generally regarded as an authority in the field of pathology also, correct?
Yes, there's a lot of different books there, and I think it's kind of a trap to say this book's an authority and say everything it is. It's the gospel, the truth. But as a general rule, he's considered somebody who his views on most subjects are pretty much the views of the majority of people in our field.
One of the things that's mentioned is that drowning is a diagnosis of exclusion. Do you believe that?
That is definitely true.
All right. Explain why that is.
The reason is that there's no thing that you can look at an autopsy that says this is a drowning. There's lots of things that can happen to people. A person can have a heart attack and end up falling in water. It's really, you have to exclude other reasonable causes of their death, and then look at the circumstances really to come to the conclusion of drowning. All the things that we commonly see in drowning, such as the heavy lungs, they can also be seen in other conditions, in many other conditions. So that there's none of them that are really specific for drowning. But it's kind of a constellation, and you really, to make the diagnosis of a drowning, you really need to see the whole picture and see the circumstances.
And doctor, are there certain findings on autopsies that may be present when water played a role in the death?
Yes.
All right. Now we went over the one, heavy lungs. Can you go through some of the other findings that may indicate that water led to a death?
The other one that's similar to the heavy lungs is people, when they drown out, swallow a lot of water. And so there may be quite a bit of water in a person's stomach. And in this case, we didn't see that. That's one of them. Another one that you see frequently from any kind of death from asphyxia, where there's lack of oxygen, and people tend to think of them in terms of cases of strangulation or things like that, hangings, are these, they're called petechiae. Petechiae are these little red pinpoint dots that you see either in the eye, conjunctiva, or in the mucosa of the mouth. And they're from little ruptured blood vessels And they're commonly seen in all asphyxia deaths, in drownings, in hangings, anything like that. But they're also seen in heart disease and other conditions, so they're very non-specific. When you see them, it raises your attention that maybe you better look carefully for asphyxial deaths, but frequently we see them and it's maybe something else. And we did not see any fatigue yet in him. So it's another finding that would support drowning, but we didn't see drowning in him.
All right, and what about foam in the airway?
Foam in the airway is something that you see sometimes in drowning, but it can go away, and it doesn't stay there, it can evaporate. And I've had many cases where investigators go to the scene, they see foam, you take a picture of it, it's gone the next day. Foam can be due, you can see that also in cases particularly like drug overdoses and heroin overdoses that are common. Also common in drowning. So it's not a specific finding. You can't say, well, that person has foam, therefore they drowned.